Welcome to the Technical Assistance webinar for the NCATS Clinical and Translational Science Award Program concerning the K-12, T32 Pre-Doc, T32 Postdoc, R25, and UM1 Notice of Funding Opportunity Announcements, or NOFOs. Questions for the UM1 can be sent to the CTSA NOFO Questions mailbox, and questions for the K-12, T32s, or R25 can be sent to the CTSA Training NOFO Questions mailbox. This is Michael Kurilla, Director of the Division of Clinical Innovation at NCATS, and I will be providing you a brief background and overview of this webinar, followed by relevant NCATS staff responding to previously received questions. After that presentation, we will take live questions with the caveat that institutional specific or unique questions will not be discussed. These can be directed to appropriate NCATS program staff for more detailed discussions. The CTSA program is administered by the Division of Clinical Innovation, whose mission is innovating the clinical and translational science field. The CTSA program comprises a national network of medical research institutions and their affiliated partners and collaborators. In fiscal year 2024, Congress allocated $629 million for the CTSA program. The CTSA program encompasses a full spectrum of clinical and translational activities, including health disparities, as well as rapid response to urgent public health needs and other relevant activities. For FY24, which ended September 30th, the CTSA program now includes the new suite of offerings inclusive of the required Institutional Mentored Career Development Award, the K-12, as well as several optional components that I will talk about in the upcoming slides. There are also several consortium-wide supported efforts in addition to other funding opportunities. The basis for the evolution of the CTSA program began in 2019 with a diverse set of inputs, including consortium members and other relevant public stakeholders, feedback from peer reviewers, as well as NCATS staff with extensive interactions with the CTSA community. During post-publication, we continue to welcome feedback on the NOFOs through a number of sources listed here. Initial feedback fell into three broad categories, including the need to help reviewers through the simplification of the grant mechanism and harmonization with existing NIH mechanisms, the need to increase hub flexibility and hub specialization opportunities, and the need to expand hub funding options. We note that the new hub NOFO does not attempt to address all of this feedback. Other elements in the overall suite of CTSA NOFOs, as well as other NOFOs, such as the recently instituted small grant program using the R03 grant mechanism, which supports research projects of our recent scholars and diversity and reentry supplement awardees, comprise elements of the overall response. Additional programmatic modifications were also implemented to ensure the program is sustainable. This involved detailed budget forecasting and modeling to ensure support for the core CTSA hub activities. Overall, the feedback resulted in the evolution of one complex application using the U54 mechanism depicted on the left side of the slide, which was inclusive of the hub, Institutional Career Development Program, and the optional National Research Service Award Institutional Training Program, to that of several more straightforward grant mechanisms depicted on the right side of the slide, while retaining and expanding upon the activities of the CTSA hub. We now have the hub grant using the UM1 mechanism with a separate yet required Institutional Mentored Career Development Program using the K-12 mechanism, and optional and separate companion opportunities, including the National Research Service Award Institutional Training Program, pre-doctoral and postdoctoral program using the T32 grant mechanism, short-term research education programs using the R25 grant mechanism, and specialized innovation opportunities using the RC2. I'd like to briefly touch upon a few topics related to program evolution. In terms of hub structure, as previously stated, we transitioned from the U54 mechanism that comprises a combined UK and T application, which was reviewed and scored as a single package, to the new UM1 mechanism with the required K12 and the optional companion training applications, T32s and R25, and the Specialized Innovation Program, RC2, which will be reviewed and scored separately. There are several advantages to this grant structure. First, this allows for the use of a more standard grant mechanism that applicants and institutions are familiar with. Second, the individual opportunities allow for a focused review of the science in each of those applications. Third, this allowed NCATS to expand the types and numbers of funding opportunities that in turn provide leadership opportunities for our clinical and translational science researchers. Furthermore, we were able to promote short-term research programs with the Research Education Grant, which were underutilized in the prior U54s, and to separate out support for the optional cores in the U54 to specialized innovation programs using the RC2 mechanism. And finally, the separation of opportunities allows for review scores independent of each other, which I will get into more detail on the next slide. The advantage of separate applications results in separate scores, which in turn allow for NCATS to consider funding the hub by itself. This is responsive to our congressional budget language to retain support for the CTSA core activities. In the former grant structure, a poor scoring K and/or T had the potential to impact the overall score of the hub application, putting the entire application at risk of not being funded. With the new grant structure, a poor scoring K and/or T has no impact on the score of the hub application itself. However, we did hear one disadvantage in our initial approach of offering the suite of CTSA NOFOs. It was burdensome to try and submit all applications at the same time. Thus, prior to the first receipt date of any application, we issued a notice of correction to allow for more flexibility in when to submit applications contributing to the overall CTSA hub activities, and the newly released and renewed NOFOs continue to have this flexibility. To be clear, the K12 is required to be submitted concurrently with the initial submission of the UM1. However, if either the UM1 or the K12 would need to be resubmitted, they can be resubmitted separately. The K12 will not be awarded without the UM1 award. A parallel clarification for the companion applications for the UM1, that is the RC2, High Impact Specialized Innovation Program, the Research Education R25, or the pre-doc and postdoctoral T32 applications. These applications may be submitted with the UM1 or while the UM1 is under review consideration, or when the UM1 is funded or the UM1 is under consideration for funding. Any of the applications do not have to be submitted at the same time. Applicants can spread the submissions out. We receive lots of questions about when to submit applications and whether an application that receives a meritorious score should be resubmitted. NIH policy states that any application that has undergone review remains active and under consideration for up to 14 months after counsel. Be sure to further discuss your unique situation with your assigned program official for more clarity. Award calculation has also evolved. In the former U54, we factored in total NIH funding by the applicant and all relevant partners over the year previous to their submission, with a minimum, maximum, and a sliding scale tied to 2.5% of the total NIH funding. Under the current UM1 mechanism, a 5-year rolling average of total NIH funding is used. There are now 4 funding request categories based on those total rolling averages. This slide outlines the rationale for the award calculation modification. As can be seen, the overall CTSA budget, viewed in dark purple, as a percentage of the total NIH budget, viewed in light blue, has declined since CTSAs were transferred to NCATS back in 2011, down from 1.58% to 1.34%. Prior attempts to address this situation relied on the introduction of a maximum budget cap for each CTSA. However, with the current number of hubs at the max budget cap and the budget projection showing an expectation that this number will increase by at least 50% over the next 5 years, the current paradigm is not sustainable. At the same time, the 2.5% tie will become less relevant for most hubs as they reach this maximum budget request. Our budget modeling and forecasting under the new mechanism and projections have been made with an eye towards maintaining as much as possible a budget neutral approach and to retain the overall same investments in the UK&T portfolio that the CTSA program currently provides. With this in mind, we are modeling based on total NIH funding received over a 5-year average of most current NIH direct funding costs of the applicant institution and their partners' NIH funding. We are no longer tied to the 2.5% increase, but can flexibly increase the size of eligibility based on budget increases to the NIH and CTSA program. We will issue updates to award information on a yearly basis once NIH appropriations have been provided. And this table shows that with the UM1 budget request falls the request for the K-12 budget and the slot request for the pre-doc and post-doc training programs. In summary, we have issued a suite of CTSA NOFOs based on feedback and have evolved the program so that investment can be sustained in core CTSA activities. There is flexibility in where hubs may invest in clinical and translational science and opportunities for growth. And as a reminder to applicants that the primary source for all funding information regarding any funding opportunities announcements is the funding opportunity itself and any notices linked therein. So please read the NOFO, the application instructions, and all applicable notices. And here we list a number of resources, including answers to frequently asked questions, resources for budget request tables, and templates for other attachments for the UM1. And finally, we'd like to acknowledge NCAT staff in making this technical assistance webinar happen. Thank you for your attention.